Phone over to you.
Thank you so much. I'm going to go ahead and begin to share, starting from the beginning. Thank you so much, Jane. I just wanted to start by thanking everyone who has made this presentation possible. I've worked very closely with Jane and Christine. I also want to say a big thank you to Lindsay, who helped with the research part of getting this presentation ready. This is going to be a rather short presentation. Unfortunately, I'm not going to be able to go into a lot of detail about any aspect of the presentation, but we will have a little bit of time at the end for a Q&A. And the idea or the hope about this presentation is to give just a little bit of information. Maybe some of the stuff will be brand new, maybe some of it will be a bit of a review. But one thing that I did with this presentation that's very different from some of the presentations I've done over the last 13 years or so is I started out by reading a letter that I have written to my own primary care provider, my primary care team. I have a nurse practitioner and a family doctor that I see regularly. And what I want to invite you to do is I want you to imagine for a moment that you are hearing this letter from your own patient or client or someone that you support within your practice. And I'm inviting you to listen to this from that perspective because you could very well have somebody, and this is a story that, though anything that you hear today might sound new to you, my story is not unique. This is very much what it's like to be Indigenous and to live as an Indigenous adult, and the experiences and the stories that you're going to hear are commonplace for us. So, I'm going to share this letter, and if we have time with the Q&A, I may be able to share a little bit more about what it was like to actually disclose to my primary care provider about my indigeneity. But I'm going to start by reading this letter that I wrote to my physician. To my doctor and nurse practitioner. Hi, how are you? That's the customary greeting when I see you in your office. Usually I'm there for something minor or routine, nothing out of the ordinary. But there have also been some chronic and seemingly unexplainable issues that we just can't seem to get under control. No, I don't drink. No, I don't smoke. No, despite my obvious weight issue, I don't eat a lot of ultra processed foods. But I keep coming back with high levels here, low levels there, pain, fatigue, depression, anxiety, some frustrating chronic issues. I come to your office and we run test after test and we treat symptoms to the best of our abilities. We try new medications, and I'm going to be on this medication for the rest of my life, and now that medication to the end of my days, and I only just turned 40. And although we don't talk about it, I think we all know that I'm going to die an early death. But I have a confession. I've been keeping a secret from you, one that explains so many of my chronic health issues. No, it's not a hidden drinking or drug habit. It's not about what I'm doing or not doing to take care of myself. It's about who I am and what I've been through. I'm Indigenous, and like my mother before me and generations before her, I endured significant early adverse experiences that shaped my health outcomes right from childhood. Our Indigenous identity isn't something we talk about in healthcare settings and institutions because historically and contemporarily, we know we don't always receive the best care when we identify. I've been fortunate that I can get by without identifying because I'm white passing. That means I can walk into places and usually pass for Caucasian. I look Caucasian, which has helped me to avoid overt institutional discrimination for much of my life. Please know I have not been keeping my Indigenous identity from you because you've done something wrong. I've been in your care for nearly 25 years, and you've always been kind and attentive. But I've spent my entire life seeing and hearing how other Indigenous peoples are treated in institutions, and the message we hear is that these places are not safe for us. So why identify without cause? Only bad things happen when we reveal that side of ourselves in these places. But the science is now clear. As Indigenous people, We suffer serious health disparities when we have experienced a high number of adverse childhood experiences. I'm telling you this now and in this way in hopes that maybe we can start to approach my health differently. Recently, my 5-year-old, who loves to help people, declared, "When I grow up, I'm going to be a doctor." Now, whether or not that's actually my child's destiny, I don't know. But what I do know is that if we don't rethink our approach to my health care, I won't live long enough to see my beautiful kindergartner graduate from medical school. So I'm going to take just a few minutes of your time to share what I've learned about adverse childhood experiences and Indigenous self identification, in hopes that this opens up new possibilities for positive health outcomes for me and for other Indigenous peoples in the region. With love and gratitude, Amber. When I started doing the research for this particular presentation, there's a lot more research now than there was when I started over a decade ago. But some of the most recent research shows how these adverse childhood experiences and high scores of and I'll talk about the study itself, but that they're linked to the top 4 chronic diseases within Ontario that result in death. So we're talking about cancer, cardiovascular and cerebrovascular, respiratory diseases, and diabetes. And I have I mean, there's lots of statistics about how Indigenous people are at much higher risk, 3 to 5 times higher risk of type 2 diabetes compared to our non-Indigenous counterparts, higher risk of complications from diabetes, higher risk of amputation from diabetes, all of that. So that's important to note. So the study itself, the ACEs study, which actually took place in the 90s, was a massive study. It involved over 17,000 participants, so a large study for its type. There have been a number of studies since then, but the original study really looked at what individuals experienced as far as childhood maltreatment or family dysfunction, and it was in these categories of abuse or neglect, witnessing violence within the household, or parental separation, or the incarceration of a household member. Eventually, it was expanded to also include children who experienced violence within their community, living in an unsafe neighborhood, living with poverty, racism. And this information, the survey was conducted along with a physical exam, and that formed the baseline for the study. And what was discovered was that the higher your score within this adverse childhood experience study, the higher your risk of long-term health impacts, negative impacts. And so they looked at all of these different biological systems and how these systems could be disrupted. And they are disrupted in many ways. So we look at things like your neuroendocrine system, how your body responds to stress. So your fight, flight, and freeze responses can be heavily impacted, and I will talk about this a little bit later as well, but also impacts the reward system of the brain. So we see a potential increased risk of risky behaviors or addictions. And then we look at your immune system, and that can lead to things like autoimmune disorders, cancer, inflammation, things of that nature. Metabolic and endocrine system. So this is where we see insulin resistance, diabetes coming in, risk of obesity, and issues with like thyroid, which I can speak to personally. And then right on a genetic level, we see issues with epigenetics, and then an increased risk of all a host of diseases, cancers, and of course early mortality. So the findings and the findings are holding true no matter how often these studies are being conducted. That the more or the higher the scores within an ACEs study, meaning the more of those early childhood dysfunctions or household of abuse or neglect that a person experiences, the more likely they are to have these various health impacts. And of course, this list isn't exhaustive. This is just an example. But the earliest study didn't specify, it wasn't looking just at Indigenous people. There have been a lot of studies since then that have looked specifically at Indigenous people. And so what they've found is that ACEs are transmitted intergenerationally. So we know that the effects of colonization and those other associated historical traumas have had an impact on Indigenous peoples and have created ripple effects. So we know that adults who had a parent that attended residential schools have increased ACEs as well. And so the Centers for Disease Control have this pyramid that show the intergenerational trauma and historical trauma as creating the foundation for these ACEs. And then you add to that the social conditions, the local context. Then we have the complex traumas, those adverse childhood experiences, abuse, neglect, etc., which lead to the disruptive development that we talked about a moment ago. And then we're talking about things like addictions, high risk behaviors leading to disease, distress, stigmatization, and eventually leading to early death. Where we often see a lot of focus is on the disease. Obviously, this is where the focus being our work within healthcare and supporting maybe some of those high risk health behaviors, addictions, and things like that. But that tends to be where the focus of social supports and health supports uh, are, and where Indigenous self-identification could actually be a benefit, but we don't see a lot of Indigenous people identifying within healthcare. So we're not getting the important health information if you're not aware about ACEs, or you're not aware that a client or a patient has these high ACEs. We're seeing less opportunities to connect with community supports, or less opportunities for clients or patients to be participants in decision making about their own wellness. However, when an Indigenous person does self-identify, then it allows for a care provider to demonstrate their openness, their curiosity, as was the case with my primary care physician when I started talking about it. She came to that with this attitude of curiosity. Oh, tell me more. She wanted to have an open discussion. It was really lovely. I felt it strengthened our relationship very much. And then we were able to start to broach some of the really relevant differences in health practices that when I made a switch, I saw very positive health outcomes for me. And that came as a result of me connecting with Indigenous health providers, that I adopted some new practices that were wildly beneficial for me. It also provides opportunities to make good community connections uh, for my healthcare team to also make connections that they didn't have before, and empowers me as an individual to make decisions about my own health and well-being. But this idea that in order to really make change, we have to start addressing ACEs from those bottom layers, the generational trauma, the historical trauma, the colonial trauma, which starts with education for everyone involved in these sectors. But it's hard for us as Indigenous people to feel safe to identify, and there's some really good reasons for that. One, and I spoke to this before, is the impacts of ACEs on our autonomic nervous system. So that's our fight or flight. So when and I speak to this personally, having had my autonomic nervous system impacted, and having a very sensitive fight or flight response, I can walk into a place and not feel safe, even though there's nothing there that would indicate I'm not. The other piece is this historical and contemporary experiences with healthcare and education that um, go back, we're talking centuries of experiences of my ancestors and my family and community who have faced systemic racism and discrimination in many sectors that tell us that it's we're not likely to get the support we need, and in fact we might experience harm. And there have been reports that show that our healthcare system has been set up to ignore the colonial history that Indigenous patients face. We also are inundated with stories in the news and media about how Indigenous people are treated when we try to access healthcare. These are the headlines. So when I was trying to find headlines for this presentation, it wasn't hard. It wasn't hard at all. It wasn't hard to find recent ones, and they were sickening. when you see them this way, it's not hard to understand why people are hesitant to, and if you can avoid identifying, which was the case when I was in hospital giving birth to my daughter, that I was very clear that I did not want my husband to make mention of the fact that I was Indigenous because of what has happened to Indigenous people. But I noticed this one headline that's jumped out at me, and this was a really, really important thing that happened last year, was this formal apology from the Canadian Medical Association apologizing for the harms. So this was a really big step in my opinion about validating and recognizing that yes, these things happened, and within my community we knew these things were happening. We talked about these things happening, and this is what we have been thinking about anytime we walk into a doctor's office, a hospital, many different kinds of institutions. And having this being recognized is a really important step. So, why would we identify? Well, there's a lot of reasons not to identify. And when we talk about things like the census, like many people in my community, I didn't identify on the census as Indigenous for many, and lots of Indigenous people wouldn't even fill out the census, because why would you? What would be the point? But between 2006 and 2016, we saw in many urban places the number of Indigenous people increased significantly. And I'm only using the data from Waterloo Region because, again, snippets of information so that we get through the presentation. But this is a huge leap, a huge increase, 87%. And stats can really attributed this to things like longer life expectancy, higher fertility rates, and an increase of people self-identifying. Now, I was one of those people that didn't identify prior to, and I started self-identifying on paper in 2013. And what a lot of people don't know, and it wasn't ever touched on in any report that I could find when I was looking at what's the reason behind this increase, but for me and for a lot of people in my community, the reason was the Idle No More movement. So it began as a grassroots movement in protest of Bill C-45, which was going to change the Indian, and did change the Indian Act, the Navigable Waters Protection Act, and the Environmental Protection Act. And what we wanted to accomplish with this movement was to let the government know that we as Indigenous people were still here. We were here in bigger numbers, and that we were going to do what we could to continue to protect the land, protect the waters, and to make it known that we were not going anywhere. Now, unfortunately, we weren't successful in that way, but the Idle No More movement had a lot of momentum, and it changed political conditions in Canada that made way for the Truth and Reconciliation Commission and the Missing and Murdered Indigenous Women and Girls Inquiry. So the call to action that was put out was like, make yourself known, right? Make it so that the government knows that we're here. And a lot of people in my community said yes, and we started to identify on the census. So we saw this huge leap because we had a reason. We were called to action, and that's why we acted. So what can we do? Well, we know that protective factors for survivors of toxic stress and early adverse experiences for Indigenous populations specifically are cultural identity, cultural connectedness, intergenerational cohesion, education, social support, and psychological resilience. So it's really important that as Indigenous people who have been disconnected, so often disconnected from culture and community, get reconnected. And this is so important, especially in urban environments where we may not have connection to culture, that we find ways to get connected because that's so important to our health and well being. So it really is relationships with community that's key to our health and wellness. One thing you can do as a practitioner is to get more education about how to support Indigenous older adults. This is while it said it Waterloo Wellington, this was created within that community, but there's a lot of practical guidance for how to talk to patients about Indigenous identity. There's some really great lived experiences from Indigenous older adults within my community who talk about their experiences. So those voices and those case studies are really, really valuable. And I think that'll be put into the chat for anyone who wants to link to it. Um, Other online courses that would be great learning opportunities are the Community Resilience Coalition of Guelph Wellington. That's a focus on ACEs. So I gave you like the tiniest tidbit about ACEs if you wanted to learn more. This is an online course with like a sliding scale. So it's between 50 and 130 to take that course. Really valuable information that's also directed toward healthcare professionals and social services. And Indigenous Canada is an online course from the University of Alberta. That's a great reconciliation course if you want to learn more about Canada's history as far as Indigenous peoples. And then more reconciliation resources like the Truth and Reconciliation Commission of Canada calls to action. I recommend everyone read the United Nations Declaration on the Rights of Indigenous Peoples. That's really important. And Reclaiming Power in Place, that's the report of the National Inquiry into Missing and Murdered Indigenous Women and Girls. And lastly, just some other things you can do if you're thinking about what you can do to support Indigenous peoples within our community and within your work. This is being recorded, so I know it's going really fast. If you want to go back to refer to it, if you're writing really fast, don't worry, you'll be able to check in with this again later. But these are some of the things you can do within your own practice. And I think we have a little bit of time for questions.
Thank you so much, Amber. What a wealth of information in such a short period of time. We only have a few minutes here. My name is Christine Platt. I'm the Geriatric Systems Implementation Facilitator for the Waterloo Wellington Older Adult Council. And I have had the privilege and honor of partnering with Amber and other team members to bring this to you. Please do let me know what questions you have. We're getting thank yous in the question and answer box, and appreciation for you, Amber. I know that was a lot of information there. Well summarized in such a short period of time. Thank you. Yes, very powerful. We've only got about 3 minutes left, and I'm not seeing a specific question yet. So I'm going to ask the question in terms of what has been most powerful for you, in addition to the curiosity that your primary care provider showed. Is there anything else in a healthcare setting that you felt made you made a more safe environment for you to self-identify to get the care you needed?
There hasn't been, I mean, there are some programs, some centers that are Indigenous led, and that's huge as an Indigenous person to know that you're walking into a space that's for you. for a non-Indigenous place, it's more about feeling confident in myself because I've done this work. Um, if I knew that my doctor had taken that course, then I would feel more confident in going in and having that conversation. But it was through the process of creating this presentation that I kind of worked up the courage to talk to her about my Indigenous. I hadn't even identified myself to her until I started working on these presentations. So if I had known that she had taken some kind of training and that was made clear in some way, like you know how sometimes doctors have things posted up in their offices, if
Yeah.
there was something there that a certificate or something that I could see that made it clear that she had done some learning, I might feel a little more comfortable with saying, by the way, I see this thing here and I just wanted to let you know. But it was kind of like taking a step off a cliff.
Yeah, yeah.
When I did mention it to her, but yeah, she was lovely, and I'm not surprised because she's always been lovely. But
Well,
it comes from a place of historically like horror stories
yeah, yeah,
my whole life.
absolutely. And you shared just the tip of the iceberg of that for us today, but how wonderful for a call to action for all of us to take the training and to let people know through your office that you are indeed taking the training. Thank you,
Mhm.
Amber. I'm going to hand it back to Jane now to close us off.
Thank you, Christine. And thank you, Amber, for this very informative, and as some people said, vulnerable presentation. I think you really shared a gift with us today. I can speak personally that each time I hear a presentation from you, I learn more and more, and I find it very humbling. And just want to thank you because the time you take to really tell your story, but also inform us on how to make change is just so highly respected. So would really like to thank you. I truly believe you're a blessing to our community and sincere thanks. And I'd like to
Thank you
also
too.
thank all the participants who joined us today. And you will be receiving the Zoom link with the recorded video. We would ask again that you please complete the evaluation that will be circulated. It will only take less than 5 minutes, and it even helps Amber in knowing how she can deliver her talks. She's been excellent in supporting our healthcare system over the last few months, and we really look forward to engaging more with Amber in our work. So really thank you, and thank you to JERAS and the RGP Central for hosting this wonderful event. Everyone have a great day.
Thank you.